A doctor riding a motorbike to raise funds for sick children, Dr. Andre Hattingh, Pediatric Care Africa Founder and a retired neurosurgeon, joins us for more on his initiative. Dr. Andre, thank you so much for joining us this evening here in SABC News. Perhaps let's start off here. Just tell us more about this very important initiative that you are undertaking.
Good evening to you. Yes, thank you. We've done our 2,300 kilometers. We are in Freiburg this evening. We have departed last Sunday, so that's our fourth day on the road. I must say today was a very hard one. But to explain to you the reason why we're riding, we have two major programs at Pediatric Care Africa. The first one is 1,000 surgeries for 1,000 children. Exactly what the name says. We want to do 1,000 surgeries for 1,000 children over a 50-year project, over 50-year time. And then, of course, the clinical medical program where we take basically children to see a private general practitioner or a private specialist. And that is the reason why we're riding to collect funds to be able to pay for all of these things. As we are self-funded, we have to do all our fundraising ourselves.
And maybe let's take a step back. What would you say sparked this initiative, especially to provide healthcare to children in rural communities?
Right. The idea actually originated in 1994 when I was a volunteer in Rwanda, and I saw that there was very little assistance available there. And then I made a promise that one day, if it's within my ability, I'll do something for the children. And I never forgot the actual promise I made in 1994. And in the end of 2016, I retired from actual medicine, and I launched Pediatric Africa. So this is our 7th year. And the whole idea is to provide poor children of South Africa a world standard medical care. Because I firmly believe that all children in the world and South Africa must have access to medical care, regardless of where you live, who you are, my apologies, and who your parents are. And that is the reason why we launched it 7 years ago.
And when it comes to the children who will be benefiting from this initiative, will they be coming from maybe the province that you are from, or is this a initiative or a campaign for the entire country?
No, our surgical campaign is nationwide. Basically, we have patients coming from the whole country. We're also opening an office in the Western Cape as in May next year to expand our reach. So no, the surgeries themselves is nationwide. However, the clinical medical is basically at this stage is from Mpumalanga and Limpopo province. We haven't reached the other provinces yet. So what we want to do, of course, with the ride, one of the purposes while we're riding is we speak to doctors at all the small towns that we ride through to ask them if they will join us and to do 2 pro bono cases for us every year, one every 6 months. So if we have a sick child, for example, in Freiburg, where we are now, we can refer that child to see a private practitioner here, and the private practitioner here can make a diagnosis and tell us what further steps to take. Is it just a prescription? Does the child need x-rays? Does he need surgery? Does he need to be referred to a specialist? So one of the things that we do on this ride is we always speak to doctors to see if they will join us in our initiative.
And what has been the reception in terms of those willing to donate to this initiative?
Exceptionally well. I must say the South Africans, we live in a very difficult country, but the South Africans themselves that we meet are the most exceptionally nice people, especially the biking community. Bikers are very well known internationally for their generosity towards children, all people and animals, especially. And South Africa is no exception whatsoever. I must say, everywhere we go, this is our 5th year that we're doing this, and we are growing exponentially every year. The number of people that meet us on the road and support us on the road. So the reception has been exceptionally good, and we are very, very grateful for that.
And how much would you say you have made so far?
I don't know. My wife will know that, or our office will know that. I'm on a need-to-know basis, and obviously I don't need to know. But we hope. I always give the figures at the end of the ride. We have a world record attempt ahead of us in the 24th down in Jeffreys Bay. And there we hope to have 4,500 motorbikes participating. And every motorbike rider and pillion, that's the person that sits in the back of the motorbike, pay a participation fee of 100 and 50 rand respectively. And that is one of the ways that we're going to try and raise funds. We also have a cookbook for sale. We have a whole lot of other paraphernalia. And then, of course, your traditional things, methods that people sponsor per kilometer or just make a once-off donation. So hopefully once all expenses are paid, we will have a minimum of $500,000 rand to show for it so we can help some children.
And perhaps tell us the mood of the bikers who are making their way to the Western Cape.
My apologies, say again, please.
I was just saying, if you could just tell us the mood of these bikers. I mean, you are not riding alone. There's a number of you taking part in this campaign. What is the mood like from the bikers?
Fantastic. We left with a whole massive group of people this year. We've been very fortunate. We have good weather. Last year we rode in the rain the first 4 days. But the exception, the weather's been exceptional. The riders has been exceptional. We have a number of people riding with us, like you correctly say. The whole route, they are in good spirits. And of course, the heat today and yesterday was a bit much for some of our bikers, I must say, because of the clothing that we wear. But the spirits in all, and in Freiburg, we had a good reception. Every town we go to, we have an exceptional reception, and I'm so grateful for all the bikers, but not only the bikers, the normal public that just greet us, say hello, come say hello, bring us watermelons. For example, in Tabazimbi, we had a lady from a pharmacy bringing us watermelons. How fantastic is that? So the spirit is great. We're all looking forward to the World Record attempt down in Jeffreys Bay on the 24th, and we actually can't wait to get there. And tomorrow we are moving into the favorite area of the country for me, and that is into the Karoo. I love riding through the Karoo, so we are quite excited about that.
All right. Dr. Hattingh, good luck on that initiative, and of course, you reaching that world record as well.